Okay, good afternoon, and thank you for joining me of our next iteration of Lunch and Learn. My name is Heather McGaffin, and I'm the director of the Office of Unified Communications. We are Washington, D.C.'s 911 and 311 Center. Each month, we're tackling topics that folks are asking us about to gain a better understanding of how our 911 and 311 program and operations work. And we are sharing some insight into things that we're doing to regain trust within our agency and to make the experience in the times that you need us be the best that they can be. So this afternoon, we are talking about call queuing and what that means. Call queuing is a technology that places inbound callers into our 911 and 311 systems into a queue. This queue is very much equated to a line, whether you're at the grocery store or something else. And so what it is doing is that it's allowing you as the caller to know that you have been connected, that you have dialed the right number, and that you are in the right place. Most of the time across our nation, when you call 911, if the call takers are all tied up or are all busy on other calls, you are simply going to hear the same ringing that you would hear when you place any call. And so it's really important to us to have a queue to let you know that you've reached Washington, D.C. 911, that we are experiencing high call volume, and that you are going to be placed in a queue, and that your call is going to be answered in the order it was taken. One of the things that we are challenged with here is when large scale incidents happen, we are receiving a lot of calls for that incident. And when we're receiving those calls, we're getting an influx of call coming into our center, and we are trying to process the information as quickly as we can. The important thing for a caller to do is to not hang up, because what's going to happen when you hang up is that you are going to be met with having to call us back, but you're also going to be met with us calling you back from a 10-digit number. So while you're trying to place the second or third outbound call to 911, your call is going to be ringing, and it's going to be saying that this is DC 911 and we're calling you back because you tried to call and you hung up. So the best course of action is always to stay on the line, keep your place in the call queue. Hanging up and attempting to redial only results in you losing the point that you were there. A lot of times when people come to us after the fact and they say, I was trying to call 911, I was met with the queue, and then so I disconnected and I called back. What we find is that had they just stayed on the line for a few more seconds, their call was very close to being answered next. So you're waiting in queue, you're calling, and then you're processed through the call taker. In 2022, our average answering time for the entire year was 3 seconds. For 2023 thus far, that call time is 7 seconds. So there is a 4-second increase. And if you ever tried calling, maybe it wasn't 4 seconds, maybe it was longer, and you're probably thinking there's no way that data is correct. But that data is looking at 365 days of the entire year. There are many times in 911 where you're not going to have a whole time that you're getting right through. What probably is happening if you're experiencing a longer wait time is that you're calling when there are other incidents that are going on, or you are calling where you're calling about an incident that several other people are calling about. So today, my goal is to be really clear about what our challenges are and what solutions we're implementing, because you never want to have to wait when you call 911. And that is my goal too, to minimize the times in the course of a year or the course of, our agency's performance where people have to wait to be connected with a call taker. So the first one is the manpower shortage, and I'll talk about our strategic recruitment and what we're doing. So a study jointly conducted by the International Academies of Emergency Dispatch and the National Association of State 911 Administrators, NASNA, which Washington, D.C. is a part of, reported that more than half of the 911 centers in the US are facing a genuine staffing shortage or a staffing emergency. We are one of those centers. We are looking to attract, hire, and retain telecommunicators, but it is becoming an absolute huge challenge for us. So we looked at different ways. We've attended seminars, we've collaborated with some of our friends and neighbors, and we've really tried to think outside of the box. And so this year, with the help of our HR department here at the Office of Unified Communications, as well as DCHR, we completely transformed our recruitment strategy. We're implementing a new process. We've created new pathways to employment. And we have also introduced a hiring bonus in an effort to attract, hire, and retain qualified team members. To my knowledge, we're the only ones in the area to be doing that. And it has proved to be successful at this point. Last month, we hosted our first prospect day, modeled after some of our other public safety partners. And what that did was help to reduce the time period it takes to get someone onboarded at the Office of Unified Communications. Typically, before this new and improved strategy, it was taking anywhere between 6 and 8 months to get applicants in, get them vetted, and through all of the steps and processes to become a call taker. With this new process, I'm happy to report that we were able to cut that by more than 50%. And with the application process that closed in May, we will be able to onboard upwards of about 20 employees starting in July. And so this is what that looks like, just for your knowledge. 190 people applied to be a call taker in Washington, D.C. They made it through the originating piece through DCHR with a full application, and those applications were sent to us. 190 people were then offered an invitation to our prospect day, and 114 people accepted that invitation and showed up. Out of the 114 people, their first step was to test. And after testing, about 100 people made it through the testing. The testing checks for speed of typing, ability to multitask, listen and type simultaneously, how to read a map, as well as cognitive decision making. After that, they were immediately sent into an interview panel where all but maybe a handful made it through that aspect. We talked about the realities of this job. We talked about the recurring trauma that we know 911 call takers experience. We talked about what it feels like to maybe have to miss a kid's soccer game or not be able to go to that birthday party. And that as an essential emergency personnel, when it snows, you're expected to be here on weekends, on nights, and that, we have a job to do, and that we can't accommodate remote workforce at this time and things like that. So we had those really real conversations. Our interview panel was staffed by people who work here, by people who are living the life of a call taker and a supervisor. After that, we sent invitations for them to do the first part of their psychological background, as well as their criminal background check. That is historically where we lose the most candidates, and that was true here as well. After those two steps, we were down to 28 candidates, and now 28 candidates have moved on to the drug screening that was done last week, and those results should be in this week for us. Anyone who passes that will be offered a position here at the Office of Unified Communications with that July start date. And then, as you know, we've revamped our entire training program, and so that they will go through the 16-week training program. If you are interested in working here at the Office of Unified Communications, we are offering a $2,500 hiring bonus, and you can scan that QR code, or you can go to jobs.dc.gov. And that job is on there, as well as a telecommunications equipment operator. We will be having another prospect day. So if you get your application in with DCHR within the next couple of days, we could probably see you at our very next prospect day. Another challenge we have is low acuity calls overwhelming the system. especially post-pandemic, an emergency situation and what it looks like has really changed. So we are implementing call diversion programs. The district has one of the highest per capita EMS call volumes in the nation. And because of that, it's straining resources for emergencies. So if we're able to divert those low acuity calls to more appropriate channels to help alleviate the strain and to get people to the right care right from the first 911 call, then we can really reduce the need for police, fire, and EMS personnel to be going out to locations throughout the city. We're connecting people the right way. So the OUC has collaborated with a number of public safety partners and district government agencies to determine how we triage those calls and where we send those calls to. So since 2018, we have developed 3 very robust call diversion programs. We have a couple others that we have recently started that are really building momentum. And we know that we have some in the future that are coming. One of the things that we are definitely most proud of is our ability to not only work with our agencies, our sister agencies at MPD and FEMS, but also the opportunity to meet with and work with other agencies such as the Department of Behavioral Health, the Department of Public Works, the Department of Transportation, to really get people to the right places at the right time. So and I'm going to talk a little bit about each of the programs that we have now. And this is great. So when you call 911 and you're having an emergency, we're going to ask you some questions, and then we are going to tell you, like, we're going to send an ambulance or we're going to transfer you to the nurse. When you're being sent to a diversion program, you can have full faith that the diversion program that we are sending you to is the right choice, that is intentional. There are times that after further evaluation, they might send you back to us for a dispatch of police or fire resources, but we're really confident in these programs. And I'm going to talk a little bit about each of them. And one takeaway I would love for everybody to do is really talk about these programs in your neighborhood, because 911 used to be a left hand, right hand thing. You either got police or you got fire and EMS, but now it's kind of like an octopus, and we can send you to a myriad of places to make sure that you're being taken care of. So the Right Care Right Now program launched in February of 2018. It's our first diversion program, and it's a program to improve patients' health outcomes and preserve the DC Fire and EMS Department's resources for patients with life-threatening injuries and illnesses. It also reduces how long you yourself, if you're eligible for this, might have to be in a emergency room. Nobody wants to go to the emergency room with maybe a laceration to a finger and have to sit there for hours just to get a few stitches. We can transfer you to the nurse triage line. The nurse can ask you some questions. They can book you an appointment at a clinic. They can set up transportation to and from the clinic. You go to the clinic, you get your sutures, you're home before maybe you were even seen by a triage nurse because of the overwhelming populations that are in emergency rooms right now. So you call 911. You let us know what's going on. We're going to ask you some questions, and then we're going to transfer you to the nurse. The nurse is probably going to ask you some more questions. They can even now put you into a telehealth situation with a doctor. They can, the most appropriate non-emergency room medical care available, and they can also do follow-ups. The police non-emergency line, again, launched in earlier in 2019, because in 2018, we had about 20% of the 1.5 million calls to OUC were for non-emergency incidents. And so to improve that call taking efficiency, we developed a pathway forward with our partners over at 311 and the Metropolitan Police Department to reroute those non-emergency call types from the 911 queue to 311, and then of course to our telephone reporting unit. With that program, we can get the information over the phone for things like noise complaints, vandalism, destruction of property, or crimes that have happened in the past where there's no injury or no suspect information. We can do the report. Those are reviewed by Metropolitan Police Department officers. Those reports then become available to you so that you can use them for things like insurance, or to get things fixed. With that in mind, that also allows for you to not have to sit around and wait for a police officer. These are things that would be considered very low priority. And so any priority call that comes in, even after you called, might take precedent. So making sure that you can do that. There's also an online portal through MPD that you can go on and process those. The latest in the series that we have really launched is the Mental Health Emergency Dispatch Program. And this was launched in June of 2020. And when it started, it was a 12-hour program that ran from 6 a.m. to 6 p.m. It is now 24/7. And this program is in partnership with the Department of Behavioral Health's Access Helpline. Mental health diversion programs aims to shift 911 calls for emergency mental health services from police dispatch or FEMS dispatch to a clinician. If you call and you're having a mental health crisis and there aren't other situations happening, we can transfer you to the Access Helpline where you are connected directly with a clinician. That clinician, much like the nurse triage program, can ask you some questions, can have a bit of a more conversation with you, and they can either send out the crisis response team, they can send you back to dispatch if that's the right thing, and the MPD officer will come out, or if there's a medical emergency, we would send out fire resources. We have been working most recently with the Harvard Kennedy School Government Performance Lab cohort for the expansion of this program. Mental health emergencies make up a good portion of the calls that we are seeing in a post-pandemic community. And we want to make sure that we are getting people not only the help they need in the moment, but giving them a pathway forward, for future care. And so as we are expanding this program through the Harvard Kennedy School cohort, we have been able to meet other cities across the nation that are doing similar programs. We've been able to expand this program. And in July of this year, we are going to expand this program one more time. We also are going to be co-locating some of our team members from the Department of Behavioral Health here with us at the Office of Unified Communications to expand that program. All of our call takers have received mental health emergency dispatch training, and they also are, continuing education to be able to identify emergency calls. And they also we're implementing systems such as the power phone system that I've talked about before that will help us to better identify calls that are eligible for diversion so that we can take the strain off of the 911 system, and so we can provide better care to these other programs. A couple others that we have that let's just talk about quickly are through DPW, the Department of Public Works, for parking. They used to sit and wait for officers to come out to. Now DPW has a rapid response parking team. And so if you call for parking complaints or things like that, if you call 911, and we really would encourage you to do 311 or to use our 311 app or tweet us at 311 or text us. But if you do call 911, we are going to transfer you to 311 for a parking emergency, as long as there's not other situational things happening. Of course, if someone is looking to start an altercation, of course, call 911 and we'll get the police out there. But if it's you go outside and somebody's parked in front of your driveway, you can call 311. Or if you do call 911, we're going to transfer you to 311. We're going to put that in for a rapid response, and then that would be taken care of by DPW's parking enforcement as part of that diversion. For auto accidents where no one is hurt, if you call 911, we are now going to be transferring you to DDOT's non-injury auto crash line. Information can be shared there. Once you're connected with them, they'll help you exchange information. They can send out a crane or a tow truck to help move you off the road. You can exchange information that will help you do that, and then you can move on. So these are all things that we are putting in place, and we are always looking for new programs to implement and new things to put in place to allow for the first responders to be available and ready, so that when there are emergencies where police and or fire and EMS are the proper responders, that they are able to come there. So now we'll move to the question part of our session, and we can do that. When I call 911, I expect my call to be answered, not sit in a queue. Why don't you have more people on duty at a time so this doesn't happen? So the first one was about the first, identified challenge was the staffing shortage. We are working really hard to get staff into our center. We are up staffing, but we have to staff 24/7, 365 days a year. And so I have a certain number of call takers that I have, and I have to be able to, they work shifts, and I have to be able to give them the time off that they need. They're dealing with trauma all day long. I also have to make sure, because they are human, that they are getting that life work balance, and I can't work them more than 16 hours because one, it's not fair, and two, it creates the situation where that's where we really start to see mistakes happen. I also am balancing the fact that we have people here who have made errors, and so I have to discipline them. I have to hold them accountable for those mistakes, and so I could be fully staffed if I had all the people that we need to be fully staffed. I don't, and so we're working on that. But I'm also holding our call takers and dispatchers accountable, and so I can't not hold them accountable just for the sake of having more people to answer the phone. Recently, my neighbor shared on Twitter that she was on hold with 911, hung up, and then your system called her back. That put her in danger. What do you have to say about that? We are required to call back, to make a call back. I know some people said, well, you should call, a person should call. I don't have enough. We, especially with things like Apple Watches, non-initiated cell phones, and all these different means of calling 911, we get a lot of 911 hangups. We get a lot of people who call and hang up. The phone is going to ring whether I call you back or the system calls you back. The most important thing that you can do is stay on the line. You have to stay on the line, and we have to, we will get to you. It's not going to stop saying that you're in the queue. We're really trying to be more conscientious about when we're seeing those high spikes. We're using forecasting models to make sure we have people. But a prime example, it's Thursday, and we know that we're in an air quality emergency. And on Tuesday afternoon, in the afternoon, as the smoke was really starting to roll into the city, we were getting a lot of calls from people who were saying that it was smoky, they smelled smoke, they saw smoke. And so we really were out on our social media trying to say, like, we completely understand this. We engage with our partners for messaging, and they were super, super responsive, and we were able to get some messaging out there. If you have a true emergency, of course, we always want you to call 911. If you have questions about things, we would really encourage you to check out social media, to log on to 311, look at the information that we're putting out. And then also what we found when we did an analysis of the calls on Thursday, a lot of our 911 calls for Tuesday, a lot of our 911 calls from Tuesday afternoon were coming from the downtown area, more near the monuments and the museums and things. And so what I suspect when I look at area codes is that a lot of those callers were visitors here to Washington, D.C. And so they were calling because they didn't really know what was going on, and they wanted to alert somebody. And so for us to get that messaging out is really top of our radar. Certainly hiring, training, and education are the three things that I talk a lot about. I've lived in the city for 50 years and council members say call 911 and let you all figure it out. I'm not sure whether I should call 911 half the time or not when I hear gunshots in my neighborhood, which is a lot. Should I? So if you hear gunshots, of course you can call. The city does have technology in place that does sometimes detect gunfire. And so a lot of times, as we kind of know that there has been a shooting because that is alerting our system. We're seeing an influx of calls coming in. You should always call 911. If you didn't see anything, if you don't have any further information, you heard the gunshots, you also have the option to text. Text messages come in simultaneously. We're going to acknowledge those just like we acknowledge a call. But all you have to do is pull up your phone, put it, open a new text message thread, do 911. It will come directly to us. We can respond to those. Of course, if you have more information, you can also call us, but you just have to make sure that you know that you're calling, and probably so are your neighbors. And so we're getting to you just as quickly as we can. I keep seeing people talk about the minimum staffing on social media. What are they talking about? So minimum staffing for our center is what we need to answer the predicted amount of phone calls. So we use a forecast system, which uses a methodology called Erlang-C, ERLANG-C calculation. Those calculations are for call centers, and it's something that the 911 center uses here to forecast calls. It looks at past days. It looks at call volume. It looks at day of the week, time of year, and a bunch of different factors kind of put in there. And it tells us how many people we should have staffed to be able to handle the calls. What unfortunately it doesn't account for are those spikes or those anomalies that you can't forecast for. And so the minimum staffing right now for our center is 22 people during the day and 17 at night, because we take a majority of our calls during the day. We are using overtime at this point to meet those staffing requirements. We are working to make sure that each and every day we have that number staffed. We are also down 28 call takers. And I've said that number before. I also have 28 people that I said went into the drug testing portion, the final portion of our hiring process. So that is by design, right? We also know that 28 people won't take the job. If they do, it'll be great, and I will be cheering the loudest. But we anticipate that probably between 17 and 19 of those positions will be filled, and that's why we're having the hiring is still opening, and that's why we're having the next prospect day to build that funnel, to build that pipeline here into our center. The other thing is we're short. We have a vacancy with dispatchers, but everybody has to come in as a call taker. So once we get more call takers in, we're going to be promoting, and then we'll have vacancies and we'll fill those, and we'll keep doing that. When we talk about minimum staffing, when we have more people, I will up the minimum staffing number. I cannot do that now because I have to make sure that the mental health of our call takers is taken care of. I have to make sure that they are getting the breaks that they need to recover. I have to look out for their wellness and their health just as much as we're looking out for the callers that call in here. And so we are really walking a tightrope here. And we understand that nobody ever wants to be put in a queue. We understand that creates challenges, that creates angst, and maybe even some distrust. And so one of the reasons I really wanted to talk about this today, and I really wanted to tackle this today, was because I am not sitting behind a screen just blanketly, saying we have a challenge here. I want to come to you and say, here are our challenges, and here are some things that I'm doing to overcome those challenges. And I'm always open to ideas. And it looks like somebody here has an idea. So for non-emergencies, have you thought about maybe an online website submission system where once a user submits an email, a blotter can be generated, automatically left in the dispatch queue? This is just an idea, and it's a great idea. And I am really interested in these types of ideas. I don't have all the answers. I don't claim to have all the answers. So this is the kind of feedback that I really appreciate. So my team's going to copy this down, and we are going to look at some of that and possibility for that. So this is a good segue to the fact that we do have a feedback form. You can find that on our website. Our website is hopefully soon going to get revamped and can be a little more easy for the user to get around to. We're also going to be, we are also working on getting real-time databases feeding to our website so that you can see in real time the types of situations we're having, where calls are kind of coming from in a generalized area, and wait times and things like that. And to the person who said they have a concept program that can do that, if you could log into our feedback form and give us your contact information, we'd love to have a great discussion with you about that. Also on our website, you can find the link to our Citizen Engagement Academy. That's going to start later this month. We are going to be talking a lot about the different things that we do here at the Office of Unified Communications, and we'd love to have residents join that Engagement Academy. It's going to be a 3-week commitment here at the OUC over here in Ward 8. And then, working toward a citizens advisory board here for the OUC. So I just want to say thank you today. I know this one ran a little bit longer than what we're used to, and I really appreciate you jumping on and joining us. Our doors are open. I just had the amazing pleasure right before this of having the ANC, Ms. Johnson from 4B06 come and join us. Whether you're an ANC or not, I would love to have you come by and see what this is all about here over at the OUC. And you can also request a tour on our website. So thank you again so much today for joining us. And we can't wait to see you at the next one. Thank you.